Hi, thank you for coming to drpip.com. Let's talk about the 4-month visit. The first thing I'm going to want to make sure is that your baby is a good sleeper. That was our big goal from the very beginning. So I'm hoping your baby is sleeping somewhere from 11 to 12 hours, 7 p.m. to 7 a.m. And if not, then you need to kind of go back and look at some of those fundamentals so we can troubleshoot what it is that you're not doing or what it is that baby's not doing, and we can try to get the baby sleeping better. From an anticipatory guidance standpoint, this is the visit where I start talking about introduction of solids. And I recommend to start solids when your baby's tongue thrust reflex goes away. What is that? That's one of the newborn reflexes. If you put something in your baby's mouth, they're just going to spit it out because they have a reflex that's called the tongue thrust. Their tongue just thrusts it out. It doesn't mean the baby doesn't like it. It's just a natural reflex. And that tends to go away around 5 months. When you look online, sometimes it says, wait till your baby's 6 months old, or wait till your baby can sit up. I don't find that either of those are the necessary indicator of when to start solids. It's really the tongue thrust, for me, that when that goes away is a good time to start solids. And there's lots of different ways to start solids. I'm going to present the one that makes sense to me. I recommend to start with rice or oatmeal cereal, and I want you to mix that in a bowl. And you're going to make it thick, and you're going to spoon feed that to your baby twice a day for about a week. Now, when you read the box on the cereal, it's going to tell you to make the cereal thin, but I'm recommending that you make it thick, as if you were making your own oatmeal. And again, I want you to feed that to your baby twice a day for up to a week. After the cereal, then I move on to the pureed veggies. And I introduce one new vegetable every 2 days, still giving that twice a day. After I've gone through several different vegetables, then I introduce my fruits. And I tend to do the fruit after the vegetables because the fruits are a little sweeter and we think maybe your baby won't develop a sweet tooth if we give the vegetables first. No rhyme or reason, except that's the rationale behind that recommendation. If your baby likes a cereal, you can mix the fruits and vegetables into the cereal. If your baby doesn't like the cereal, just give them the fruit or the vegetable by themselves. Some people want to give avocado first, and I'm fine if you want to do a different method, or some people even want to do baby-led weaning, which I'm also okay with. Whatever you want to do, I'm okay with. I just want you to make sure that you're starting your baby on some sort of solids around 5 months or so. There is one thing that I feel very strongly about, and that is I want you to give your baby water whenever you start the solids. And when you give water, initially you're going to do that out of a bottle, and then you're going to transition over to a sippy cup. I would like you to give 1 to 2 ounces of water with every feeding. And the reason why I recommend the water is because if you don't give water, your baby will get constipated. So we're trying to avoid constipation. And if you remember, that's why the box of cereal is going to tell you to make the cereal really thin and watery, because they're not telling you to give water. I'm telling you to make the cereal thick so they get used to a different texture, but then I want you to give water so that they don't get constipated. And I compare the first time you give a baby water to the first time you tried beer. For most of us, beer is disgusting. We hated it, and we had to force ourselves to drink it over and over again. And eventually we acquired a taste for beer, and I'm hoping your baby will acquire a taste for water. So I'm pretty sure they won't like water at first, but I want you just to continue giving it over and over again. Now I'm going to change subjects. I'm going to move to allergy prevention. This is going to sound a little bit crazy, but I would like you to give your baby peanut butter starting today. That's right, today, 4 months, I want you to start feeding your baby a little bit of peanut butter. There's 2 ways that I think of that you can give your baby some peanut butter. First, you can get a little bit of creamy peanut butter and put some on your finger and just put it in the baby's mouth, and they'll take a lick or 2 of it. And you just need to have just a small fingertip. Or you can get these peanut butter puffs that they sell called Bamba, B-A-M-B-A. And they're a peanut butter puff. And the baby will just hold that and kind of gnaw on it and chew and hopefully get a little bit of peanut butter in there. And I want you to give the peanut butter every day. And after about a week, I want you to then introduce a little bit of scrambled eggs. 1 crumble of scrambled eggs. And all you're going to do is put that crumble in the baby's mouth. And the baby has a tongue thrust, so we know what's going to happen. The egg's going to come right back out. But if you keep shoving it back in, usually after the 3rd time you shove it in, it stays in. And then the baby will suck on it, may swallow it, may spit it out. But again, you're just kind of exposing them to the egg protein. And I want you to give the eggs and peanut butter on a daily basis. So starting now at 4 months, you're going to start with peanut butter once a day for a week, and then you're going to add in scrambled eggs, just one little crumble once a day, doing both eggs and peanut butter. People often ask me, well, what happens about an allergic reaction? Again, it's very unlikely that your baby's going to have an allergic reaction, particularly if we start early. We found that the earlier we start peanut butter and eggs, the lower the risk of allergy. So that's what we're trying to do, is try to avoid the allergy. But most of the times, if they do have an allergy, it's going to be something like vomit or a facial rash. Very, very, very unlikely that I see them going into anaphylaxis. So if they vomit or have a facial rash, you'll give a dose of Benadryl, you'll call the doctor for additional advice. Now, anaphylaxis isn't where you take a taste of peanut butter and all of a sudden, you can't breathe and you drop dead. It happens over hours. There's going to be a progression of symptoms. At first, there may be some cough. There may be a vomit. There may be a facial rash just with some redness. Then you develop hives and then stridor. And you see that things are just kind of progressing. And what I want you to do in that case is call 911, because you want the ambulance to come to you and be able to administer epinephrine, as opposed to you driving to the hospital and trying to get to the hospital. You will save much more time if you call 911. And that's really my advice for starting solids and introduction of peanut butter and eggs. Then I add one other thing that I always talk about, and that is teething. Because all babies who are 4 months old are in this oral phase where they're drooling, they're chewing on everything, and they're putting everything in their mouth. And everybody thinks, oh, they're teething. But usually they're not. Teeth typically come between 6 months and 9 months. It can be as early as 4 months or as late as 18 months. But even a kid who doesn't get their first tooth until they're 18 months old is doing the exact same thing that your baby is doing right now. They're drooling, they're chewing on everything, they're putting everything in their mouth. And that is just kind of our typical kind of oral phase that the babies are going in. Okay, that's pretty much all my anticipatory guidance that I give at 4 months. Congratulations again, and I hope you have a good sleeper. And thank you again for coming to drpip.com.